George Mason University study estimates that a Bernie Sanders type of plan would cost over $32.6 trillion. Now, to put that into perspective, it nearly doubles the size of our already bloated federal government right now.
So that study that you mentioned, it actually estimated that overall health care spending would be lower under single payer. Okay, actually $2 trillion less over 10 years. We have 29 million people uninsured in this country. We have 44 million people who are underinsured, which means they have insurance, but with gaps in the coverage so big it's as if they aren't insured at all. 35% of Americans go without needed care due to cost. I would argue that that is unaffordable.
The salaries of doctors in America is higher than everywhere else. How do you reduce that salary to levels of other countries to make this work?
Frankly, you could move to a single-payer system in an affordable way and still pay doctors roughly comparable to what they're being paid now. The biggest savings in moving to a single-payer healthcare system is in eliminating, or rather reducing, the enormous amount of waste in our health insurance industry. That's the biggest source of savings. And the second biggest source of savings is, as you said, high pharmaceutical costs.
If the hospitals go out of business, the doctors all just no longer work because they're not getting paid below market rates. It says will cut their pay by over 40%. I mean, then where are you going for care if that happens?
Many nations have done this. None of them have had their hospitals close or their doctors flee for other countries.
That's not quite true, Doctor. How can you guarantee that our quality of health care won't go down the way it has gone down in Great Britain as a result of their socialized system?
But overall, the healthcare systems of these countries are quite high quality. Overall, they have higher life expectancies than we do. They have lower infant mortality. But overall, these nations achieve better results with less money.
Why can't the free market work? If the market can work like it does with auto insurance, there's no one out there that lacks for auto insurance, no matter their record, if they're willing to pay for it. Why can't we do that in health care? Why do you want to go to some centralized Soviet-run Medicare for all?
Let me push back. A true free market in health care is something no nation, no civilized nation would ever accept. You'd have people literally dying on the street because they couldn't afford the care. You can't have a free market in health care when you think something is a right, that's something everybody should have, that people should have health care by virtue of being a human being, then you cannot leave it to the free market. That means that people who can afford it get it and everybody else suffers. We need as a nation to decide that that's not going to be acceptable.
Everything you have said on this program so far makes 110% sense to me.